So if you're a family member that's considering sending your loved one to the Meadows, you might be wondering what we do here and what treatment is all about. Oftentimes, family members are left at home dealing with the many consequences of the addictions. Oftentimes, there might be job loss, financial loss, relationship consequences, and fallout as a result of the addictive behavior. Most people that come to treatment because their life is in crisis. And many times when the addict leaves for treatment, the family members are left at home dealing with the crisis and feeling like the addict gets to go to a spa-like environment or a retreat environment, and I'm left here holding the bag of cleaning up this mess. So I want to just take a few minutes to describe treatment and what it's like to help you understand that while, yes, the Meadows is in a beautiful location and it is like a retreat in the mountains, it really is not a retreat for the client doing the work. We actually it is an extremely rigorous treatment process. So the clients come in and do a full battery of testing that is very involved and is strenuous. And then they engage in a treatment protocol that includes over 50 hours of intensive group and individual therapy each week. It can be quite exhausting and emotionally intense. And so, yes, we do incorporate some activities such as yoga, mindfulness meditation, Tai Chi, those types of art therapy, those types of activities. However, even those are strategically placed on the schedule to follow intensive therapy processes. It's important when somebody is involved in an intensive therapy process that they are also able to regulate their emotions when they're dealing with facing their demons and the consequences of their behavior and facing up to that and taking responsibility. It can be very emotional. And that is a key part of the work. We ask the addicts to really take responsibility and own their behaviors and be accountable for their behaviors. Sometimes that means making amends, making emotional restitution, taking financial restitution, taking responsibility in many different ways, and really facing the behaviors and the consequences that they've caused. And that's a really important and integral aspect of treatment. In addition to that, they're often having to do pretty intensive trauma work. Many of our clients come in with extensive histories of trauma, and they also have to take a look at those issues in depth, and that's a really key part of the healing process. And so that can be very emotional as well. And so we really, while it is a serene environment, the work here is not easy. Another concept that can be misunderstood by family members is this concept of powerlessness. And so when an addict says that they are powerless over their addiction, that does not mean that they do not have responsibility to take control of their behavior. It means that they need to go to any length possible to stop their out of control behavior. So it actually, to the contrary, the reverse is true. It means that they need to step up, take responsibility, own their behavior, and make amends for it. And that's all part of the treatment process. So this is really not a place that people come to escape. One of the other key factors that is very common, unfortunately, for our patients is many come in suicidal. And so we have to sometimes do one-to-one suicide protocols for our clients, psychiatric intervention. So the multidisciplinary team comes together and makes an individualized treatment plan specific to that patient. It may include medication, monitoring and adjustment, and in addition to the rigorous therapy. So we incorporate not only Patrick Carnes's 30 task model, which is incorporated in detail in the treatment process, but we also incorporate many other evidence-based treatments for sexual addiction and compulsivity. So that includes things like cognitive behavioral therapies, mindfulness meditation, trauma treatments like EMDR, somatic experiencing. We have groups like psychodrama, art therapy, we do biofeedback, neurofeedback. We have a brain center. So really a very comprehensive treatment approach, obviously intensive family therapy, spirituality groups. So in addition to 12-step, which is also core to the process. So really, it's a very rigorous treatment protocol. We require them to do the work. And so, if you're concerned about them just coming here to take a vacation, I want to stress and emphasize to you that that's not what treatment is about. We hope that you can come and visit us in the Family Week process, and look forward to getting to know you during that process. Thanks for joining me in this important topic today. I hope you'll follow us on our YouTube channel. Thank you. Okay.